Hello and welcome to Integrated Clinical Vignettes with Dr. Carlo number 4. A young lady, 18 years of age, comes into the emergency department with the vaginal growth. Her past medical history is unremarkable. She complains of dyspareunia, intermittent vaginal discharge during micturition, and episodes of pain when inserting her tampon. She denies vaginal bleeding, urinary retention, or incontinence. Her vitals are blood pressure of 132/84, a respiratory rate of 14, heart rate of 78, temperature of 37 degrees Celsius, equivalent to 98.6 degrees Fahrenheit. Pelvic examination reveals a 2 cm by 3.5 cm pedunculated, mobile, non-tender, cyst-like mass protruding from the lateral wall of the vagina. Urine analysis and pregnancy tests were negative, and a vaginal dye test is positive for clear fluid saturation. What is the most likely cause of the patient's presentation? In order for you to successfully tackle this clinical vignette, it is imperative that you understand the location of the lesion and obviously the symptoms. The lesion is located in the lateral wall of the vagina. The symptoms include dyspareunia and vaginal discharge during micturition, along with difficulty with inserting her tampon. Our first differential is Barton's gland cyst. The Barton gland itself is located on the lateral aspect of the vagina. It has a duct that it hooks up into, which then drains into a groove between the hymenal ring and the labia minora. Are you picturing this? The reason for that is because if this Barton gland was to get obstructed, then normally the Barton gland itself is not palpable, except for very thin women. Perhaps when the woman is conducting a self-pelvic examination, she feels these glands inflamed. And that's when you might find it or hear about it. The Barton gland itself is homologous to the bulbourethral gland in the male. And most of these cysts, as I mentioned, are found by self-examination or diagnosis based on clinical findings. Next differential, a Gardner duct cyst. A Gardner duct cyst is a remnant of the Wolffian duct, also known as your mesonephric duct, which would be the component embryologically that then gives rise to the male. If the Wolffian duct remains, or remnants of it remain, then on the posterior and the lateral aspects of the vagina is where this particular cyst would then develop. This cyst would develop as an infant, but then would not truly present until adolescence, when this female might want to insert a tampon, but is having a hard time doing so. Is having a hard time with intercourse, it might be painful dyspareunia. Most of the time this cyst can be excised, however you're always running the complication of bleeding, so thus a better step of management would be to marsupialize. And what that means is you go from the outside, you open up the cyst, and then you drain accordingly, and then you suture things back up. Keep it simple. Marsupialize. There's a chance that Gardner duct cyst may communicate with an ectopic ureter or that part of the urinary system, and thus necessitates the need for proper imaging of urinary tract to rule out such urinary anomalies. Our patient is having vaginal discharge upon the act of micturition. Leiomyomas, fibroid myomas are other names for this. It is the most common pelvic tumor. Incredibly important that you know this. Peak incidence between 20 to 40 years of age. Occurs more so in the African American population. These then appear as being multiple discrete tumors, well demarcated, with a whorled pattern. A whorled pattern. What does that mean? If you take a look at your thumb and take a look at your thumbprint, you have a circular pattern. That's a whorled pattern. Now these whorl patterns of cells are monoclonal, smooth muscle cells arising from the myometrium. These smooth muscle cells tend to be responsive to estrogen, so therefore, during the reproductive years of pregnancy, unfortunately, it may lead to miscarriages. Might be associated with prolonged bleeding, and so thus, as you guessed it, iron deficiency anemia tends to be a complication. Leiomyoma, a benign tumor, will never progress onto leiomyosarcoma. Sarcoma botryoides is a variant of a global pediatric soft tissue sarcoma known as Rhabdomyosarcoma. This specific sarcoma botryoides, a variant, is of the embryonal Rhabdomyosarcoma type, affecting children less than 6 years of age. Because of its muscular origin, the histology is spindle-shaped and occurs in children less than 6 years of age, and will be Desmond positive. Keep in mind, however, pediatric soft tissue sarcomas are only accountable for 7% of all childhood cancers. Of the pediatric soft tissue sarcomas, Rhabdomyosarcoma tends to be the most common, coming in at 50%. Once again, the unique type and variant that we're discussing here is sarcoma botryoides, more commonly found within the wall of the bladder or perhaps the vaginal wall. Rhabdomyosarcoma tends to occur in the head and neck of a child. Could be the orbit perimeningeal. When I speak of the orbit, a couple of differentials. Perhaps rhabdomyosarcoma. But as I said, very small in occurrence in childhood. Retinoblastoma, leukocoria, leuko referring to white reflex, retinoblastoma, a child. Ocular melanoma, an older patient, 50s, perhaps 60s, upon fundoscopic examination, find pigmentation. Most cases of rhabdomyosarcoma are sporadic. However, a familial predisposition is associated with Leishmania. Hence, there's a population of rhabdomyosarcoma patients in which p53 gene has to be further investigated. Skein glands. Skein glands are periurethral. Think of the anatomy. Periurethral, anterior portion of the vaginal wall. Periurethral, having obstructive type of urethral issues, inability to proper void, things of that nature. Whenever there is an anterior vaginal wall mass, differential diagnosis should be urethral, is something that you might be thinking about, perhaps a diverticulum, maybe a prolapse, skein gland, cyst, or infection. A Barton gland, once again, located by the vestibule, lateral aspect of the vagina, usually not palpable, except if a patient is very thin. A Gardner duct cyst or infection. A Gardner duct cyst, a remnant of the Wolffian duct, aka mesonephric duct. The answer to our clinical vignette here, in fact, is a Gardner duct cyst, for reasons that we mentioned. Teenager, having dyspareunia, having painful difficulty with inserting a tampon, and micturition, there is vaginal discharge.